Hi, Jonathan Hobbs here, developer of the Hobbs Masters Needling Series and chairman of the AACP in the UK. Just want to spend a few moments talking to you about treatment intensity and dose and prescription. One of the things I commonly find when it comes to acupuncture and dry needling is clinicians like to put a lot of needles in, like to get a lot of stimulus, looking to get as much de chi or reaction as possible. And one of the things I would say about that is that when we look at the definition of optimum dose, that's defined as the minimum required to get the desired result. What I ask you to do when you're clinically reasoning is think about, well, what's the pathophysiology of the problem? What are we trying to achieve here? What are the problems? What are the goals? And then work back from that. And when we think about those goals, perhaps those goals are to increase range of movement or to reduce pain or to help with healing or so on, or to reduce dysfunction, improve with patterns of movement. It could be any of those sorts of things or all of them. You need to think then about how we're going to achieve that and where needling fits into that. One of the problems with being aggressive or using lots of needling is that it can create a lot of fallout, a lot of soreness, a lot of discomfort. It can also create a lot of reaction in the patient at that time. We can get strong sympathetic responses, which might not be desired so much. So we need to really think about what we're trying to achieve. So perhaps needling a little bit gentler sometimes or starting very gently. I've mentioned before in a video on trigger point needling that we think about this concept of needle stimulus from 0 to 10, where 0 being no stimulus and 10 being the most stimulus you could generate in a client. Well, if we think about starting very gently, insert the needle so patient doesn't feel anything, and then bring the stimulus or bring the chi to where you want it to be. Don't start at 8, 9, 10 on that spectrum. Try to start as low as possible and then to generate those responses where you want them to be, because you're controlling that stimulus based on your clinical reason and the outcomes you want. Remember that optimum dose is the minimum required to get the desired result. So think about whispering to the cells, not shouting at them. The body knows it's got a needle in it. It knows that reaction. The central nervous system is aware of everything. Let it react to that. Let it get that change. Let that myofascial response occur as well. Let those local reactions, those segmental reactions occur. And test, retest. So if you do that within treatment session, then you know if there's been a change. If there hasn't, you can always apply more. But it's very difficult to come back from that. All I'm going to ask you to do is to entertain that idea. There's a quote that's attributed to Aristotle, which is the sign of intelligence is the ability to entertain an idea without accepting it. So all I'm going to ask you to do is to entertain the idea of treating more gently and see what happens. If it works for you, great. You've added another layer into what you can do. If it doesn't, you've lost nothing. So try that out and apply it to your clinical reason, your clinical practice, and we'll talk again soon. You take care.